Hi, I'm Derek Lata.
And I'm Olga Villaverdi. Today, we're here to better understand ADHD in children, and we're also going to cover ADHD in adults and what's the difference.
Very nice. And joining us to talk about this today is Amy Exum, a psychotherapist at Baptist Health, South Florida. Welcome to Smartlife.
Thanks so much for having me.
Amy, there's a little confusion. Things have changed a little bit. ADD, ADHD. Can you explain what's going on with that and what the initials stand for?
Sure. So ADHD stands for Attention Deficit Hyperactivity Disorder. ADD, which is an older term, we really don't use it anymore today, is Attention Deficit Disorder. So Attention Deficit Hyperactivity Disorder is a persistent pattern of someone struggling with either paying attention, focusing, or a struggle with hyperactivity and impulsivity.
Okay.
So I feel like a lot of us struggle with these things on a regular basis, but that doesn't mean that we all have ADHD, especially in the age of social media and our phones and being pulled in multiple directions. But what we're really looking at is, are these behaviors, these patterns of behaviors, starting to interfere with us being able to live our daily life? Is it interfering with us being able to get good grades in school, to be able to succeed at work? And is this happening in multiple areas of our life? So for some individuals, it may just happen at home, but others it'll happen at home, at work, at school. And so we're looking at how does it impact someone's whole life.
So as a parent, when should a parent really have that aha moment? I always call those things aha, where you wonder, okay, because I'm very hyperactive. I was extremely, probably more so as a child because I'm getting older now and losing the energy. But when does a parent say, okay, her hyperactivity is getting beyond now, and now the aha moment goes off that I say, I need to check this out?
Sure. So I think when you have that feeling of, my kiddo's still pretty active, pretty hyper, or I hear other people telling me, your kiddo's really active or has a lot of energy, or you feel that it's starting to interfere with things like going out to eat at a restaurant, playing with other kiddos. Yeah, I think that's just because you're saying, I'm going to stop and mention that, but a lot of times actually attention deficit hyperactivity disorder really impacts a kiddo's ability to make friends.
It's almost like a gut feeling that you kind of see and you go, wait a minute.
Yes, or even if you hear teachers mentioning things to you nicely in the beginning until they flat out say, I think your kiddo needs an exam for ADHD.
But Olga, in the intro, she talked about there's also adults that have it. It's wise to try to get to it when they're children. If you don't get to it then, it's going to continue, or can you develop it later in life, perhaps?
Great questions, really great questions. So with ADHD, it typically does develop before the age of 12 years old. We can see it as early in preschool, and with preschoolers, it really looks more like hyperactivity rather than inattention. When kiddos move on to elementary school, that's where we really notice the inattention. Again, big picture. Also, it tends to happen more frequently in males, than females, at about a 2 to 1 ratio. And with females, we're really looking at their symptoms tend to be more of that inattention, whereas with boys, it does tend to be more of that hyperactivity.
So let's talk about treatment, okay? Because obviously then there's I'm not for treatments. I even question all this labeling with these children. So I'm not into the labeling either. Maybe I even had it as a child, worked through it. Yeah. To be completely honest here, full disclosure, and obviously turned out pretty much okay. Let's just say okay. I'm not going to say great.
Modest.
Modest, thank you, and humble always. But for those that maybe need that treatment, and there are cases, what are the treatments and how quickly can you diagnose this?
Sure. So when I hear you say I'm not a big fan of treatments, I'm assuming you're leaning more towards medications when you're talking about that. Okay, so when we're talking about treatment for ADHD, actually there's multiple kinds. So one, we're looking at medication. However, the American Pediatrics Association really recommends that medication isn't used until children are 6 or older, just because there are a lot of side effects. So when we're looking at really young kiddos, we're looking at behavioral management and parent training. So what that means is it's really treatment for the parents. It's getting the parents to learn, how do I interact with my kiddo so that they learn how to manage their symptoms. So treatment can include both medication and behavioral therapy. So for some people, it's one or the other, but a lot of times we find that the combination of both works really well.
You would
It's going
think
to
that
depend on each person.
Also, you would think that you would start with the behavioral change first before going to the medication. Are they still
Especially
using
for
Ritalin?
kiddos.
They used to use that in the old days. Is that still around? Is that?
It's still around. It's a great medication. Again, it's going to depend on each person, and absolutely, because there are side effects that come with medications. We want to try that behavior therapy first.
Kids.
However, again, there are going to be some kiddos and some adults where the symptoms are so severe we may need to include that medication so the behavioral therapies can take effect.
I want to talk about the parent, if you don't mind, because I know
Sure.
we're talking about the child, and we always forget about those that are caring for that child. How difficult is it for parents to come to the conclusion, okay, there could be this issue, and they come to you and they need that help from you too, because we have to consider their emotion, because every parent wants their child to be
Absolutely.
very successful and healthy and thriving.
Sure, absolutely. And I think I see both spectrums, right? On one hand, it's, I'm scared, I'm concerned because
Right.
my kiddo has this diagnosis. For other parents, it's a relief because, I actually know what's going on and now I can help them. So absolutely, it takes a toll because, again, if we look at what the recommended treatment is for kiddos, it's really the parents learning and getting education on how to work with their kids and work with their symptoms. It's behavioral management. And also there's this aspect that kiddos with ADHD versus a kiddo without ADHD, you can tell, an 8-year-old, go upstairs and go brush your teeth, and somebody without ADHD, that kid will go upstairs and go brush their teeth.
Right.
A kiddo with ADHD will start walking towards the stairs, get distracted because they see a toy, start doing something completely different, and that kiddo's right into whatever they're doing, and now the parent's frustrated. Didn't I just tell you to go brush your teeth?
Yeah.
But with kiddos with ADHD, we have to be very specific. So it's not go brush your teeth, it's sweetie, go straight up the stairs, go into the bathroom, turn on the water, put the toothpaste on your toothbrush, and keep going.
Understood.
And for that child to get help, the first obstacle to overcome is the parents' acceptance of that my kid has this. Because a lot of them, they think it's a failure on their part that they did something wrong. My wife's a school teacher and she sees that all day long, and some of the parents are just completely, they say, no, not my kid, not my kid, and they need help.
Right.
And they need help. Yes, and if kiddos get that treatment early on, they're set up for success.
Oh, that's great. Can they outgrow it?
Good question.
So it's, ADHD is something that can last a lifetime. I wouldn't necessarily say someone outgrows it.
You can learn to live with
Manage
it.
it.
Exactly.
How's that?
Exactly. And
Okay.
so, like you said, you may have had ADHD growing up, but you had the skills. It was part of who you are to
Right.
be able to persevere and just say, I'm going to find a way to work with it.
And I will end on a high note and say that in high school, and I won't name the teacher because she still lives, I was voted the least likely to succeed in life because I was so energetic and hyper. Can you believe that?
Were you,
Really?
were you labeled?
I hope she's
Really?
watching now. So there you go. I guess my point is if they label you and say something, persevere, don't listen, move forward.
That's motivation.
Yeah, and I would just say, for those parents who struggle, right, with the diagnosis, to not think of it as a label. It's just added information so you know how to work with your kiddo. It's just like some people have low blood sugar or high blood sugar. They know they have to make adjustments to their diet. It's the same thing here. It's how do I make those adjustments? Because those kiddos who don't get treatment, if you had ADHD, you're a lucky one in the sense that you were able to persevere. But we do know that kiddos who have ADHD and don't necessarily have that support have poor academic
I know.
achievements,
Correct.
don't have successful
But if anybody's
careers.
watching here, they have to know that you can succeed. I am so
Absolutely.
passionate about that.
Absolutely, and I think we work with our strengths, right? Energy for you is a strength,
And our
for me as well.
liabilities.
Exactly. So.
Right. Amy, thank you so much for the information. Can we set up a session with Olga?
Oh no, we'll switch it around. She can give me a session.
I mean, thank you for being on the
I don't
Starlight.
want labels. No. I do have one label. I'm extremely loud. I love that one.
Just Cuban.
More Smart Life after this.
Twelve-year-old Story Jackson was born with microtia. Her right external ear never developed, resulting in the inability to hear from that ear. It wasn't a problem until middle school.
She kind of would feel left out, like if she's sitting on this side of the table and her friends are over here talking about something and everyone else is loud, she was always like having to kind of turn her head like, what?
Story also realized it might someday affect her dream job.
One of the things I want to be when I'm older is an orthopedic surgeon. I would have to hear my surroundings and know what's going on for the sake of my patient.
So when the Jackson family heard that the adhere became FDA approved in 2018, Story became one of the first 25 people in the country to receive this stick-on device.
It works by capturing the sounds through the microphone that's on the side that it's being worn, and it sends those sounds basically through little vibrations through the bones and the skull to the hearing organ itself.
All right, you feel the button there? Go ahead and push it for me.
When it turned on, I was like, I can't believe I can actually have this.
When we got home, she was like tapping her feet on the floor, like, listen to that, because everything sounds different.
At her 2-week checkup, Story was hearing clearer than ever.
Hot dog.
Hot dog.
I'm Marty Salt reporting.
You have a question? We've got the answers. Stay tuned for our Ask the Experts segment.
You're watching The Smart Life on the Health Channel on South Florida PBS. If you'd like to learn more, please visit the Smart Life page on our website at